Asked the question a while ago about the emergency rooms. I worked Trauma 1 here at University, and I worked Trauma 1 at University in Galveston. I can't tell you how many times we had to close the emergency room because of the overflow of just normal, everyday people needing care for things that should be done by a doctor. Unless we can come up with a plan of some kind that ensure people where they can go to the doctor and stay out of the emergency rooms, we will never fix the problem.
Let's see, the gentleman on the front row had his hand up first with a light-colored shirt there, number 2, second seat. Yes.
Yes, sir, this is a telling question. It's about leadership. It's not necessarily about facts, but I'd like to know if President Obama wanted the wounded soldiers from Iraq to pay for their own medical care with private insurance, how are we supposed to believe in him to begin?
I apologize, I didn't pick up on the end. Did you have a question for me?
How are you supposed to believe what?
Yeah, I'm not looking at your leadership, sir. You have always exhibited leadership. I said if President Obama had wanted the wounded soldiers from Iraq to pay for their own medical care with private insurance, how are we supposed to believe in him to begin with? Yeah. He's going all around the country pushing for a health care plan that is supposed to be better, but yet, is that how we would want to treat our wounded soldiers?
And just to add that as a physician, I've seen the 25% of people who don't have health insurance, and I assure you, a lot of those people, there is no way they can pay their bills. And I also assume that all the rest of us are already paying for it. We are already paying for it. We need to find a better way to pay for it and to be humane to those people. Do you think there is a possibility of a bipartisan solution to this problem?
Real quickly, we do need health care reform. I'll agree with that. I think everybody knows that. But we do not need the kind of health care reform that's sitting on that table in that bill. If I could be so bold to give you a couple solutions to take back to the Congress and to the senators, pass it on to them, I would say number 1, allow insurance competition across state lines. This will reduce the premium and the cost of health care immediately. Number 2, I spent 8.5 years as a nuclear weapons artillery officer. I started 3 pharmaceutical companies. I started a small property management company. I understand the economics associated with running a business and defending this country and making the right, hard, tough decision. I appreciate the hard decisions you've made, but at the same time, we have to have massive tort reform nationwide.
I'm going to have to press you to ask your question. Please ask your question.
Yes, sir. One more quick solution. And that is, there are many people who are uninsured. We do need to look out for our brothers and sisters. We do need to take care of them. But we can do that without throwing the baby out with the bathwater.
Ask your question.
My question for you, sir, is will you take back to all of your fellow representatives this statement? If those representatives want to talk about things like voting for end-of-life options, I would like to suggest that they first start reviewing their political end-of-life options, because we will vote them out.
Okay?
The president has surrounded himself with a health care czar who would never pass muster if you folks had voted in. He's got a communist, self-avowed communist as his breeding. A former founder of the Weather Underground wrote the sin.
Question from the group outside. Question from Larry Bowman. I don't think we've spoken very much about this tonight, but I know it's an issue. And that is the question of how undocumented persons may be treated in this bill. Will they get Social Security and or other benefits?
The way the bill is written now, it specifically says that no one that's here illegally will receive services under this piece of legislation.
Okay.
How can you call this a universal health care system when Congress and the President is not going to participate?
This gentleman in the blue shirt, I've seen him all night long in the green shirt.
Congressman, thank you very much for your time. You're starting to sound like a Republican. However, I do want to, and I commend you for that. Secondly, I do want to say this bill has some provisions in it that trample on our civil liberties. Like the IRS will have to furnish to the state health commissioners and to the National Health Commissioner income tax information when it's required. It's in the bill.
Okay. Your question is,
do you support that?
all right. This lady has tried all night long. Quick question. Right here, real quick.
Thank you for being here tonight, and I definitely do say that thank you for coming out and listening, because there's a lot of yellow bellies that haven't. So, thank you. I think I am as frustrated as everyone else here tonight with the things that are going on in Washington, D.C. I want to know, overall, are you going to support your constituents on anything that they feel strongly about, whether it's health care, whether it's the situation of this ridiculous czars, one right after the other? You're our That's right. boy. You're our boy. And I expect, and we expect you to go back and stand up.
Okay. All right. We got your question. He'll answer your question. Nick, over here, the veteran has been trying all night as well.
Good evening, Congressman, Mr. Mayor, ladies and gentlemen. My name is Nick Pena. I'm Vice Commander of the C.P. Garcia chapter of the American GI Forum, and I'm the Texas Veterans Affairs Director here in Texas. My question to you, Mr. Congressman, is the uninsured going to be covered under this health care reform?
All right. Gentlemen, the young man back here, he's had his hand up all night. His arm must be tired. Quick question, and then we're going to go around. No. The gentleman behind you.
Hi there, Congressman. It was really hard for me to get in here. You could just ask your staff. I'm not doing my business. But I just wanted to say thank you. You're one of the only representatives that actually represents their constituents. But here's my question. The Obama administration said that it was probably about 30% off on its 10-year deficit projections. Now, if they're 30% off on health care reform, what does that mean for my generation when we have to pay this off in the next 2 years?